Hey guys, what's going on? Welcome to another video on my channel Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipeline. Visit my website at hairliciously.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. So the other day, I came across this interesting yet predictable post on Trestlist by a guy named Goom, and he actually shared with us his before and after photos on what had happened to him when he stopped using hair loss treatment medication. Later on in the post, he comments that he was on Minoxidil. He was also taking RU-5841, microneedling, and this was starting back in November 2021. 1 month in, he started noticing some pretty good regrowth, and after 3 months of said treatment, he claims that he was able to obtain a full head of hair again. He does mention that he had to stop using his said treatments 3 months after due to personal reasons. And as you guys know, hair loss treatments have to be done long term. You really have to be committed, and the moment that you guys stop using it is when you are going to lose all of the gains that you're able to achieve. So we already know that the outcome of this is going to be pretty obvious. If you've seen really good hair growth while incorporating topical minoxidil into your hair loss treatment regimen, and then for some reason you just decide to stop cold turkey, you guys are going to lose all of the gains that you were able to achieve and revert back to how your hair looked like prior to treatment. And sometimes, I think it's very important to visualize the impact and devastation that cessation of minoxidil can do to all the hairs that you once had, and the hairs that you were able to reminiaturize and grow back. So here's a photo of him 7 months ago, before he started his treatment. He's 21 years old, and this is his baseline. We can see moderate diffuse pattern hair loss with temporal recession. I'd probably place him somewhere around a Nord 5, Nord 6 diffuse. He's somewhat holding on to the island portion, but it's clear that we can see noticeable thinning on the crown area and the mid-scalp. And bluntly speaking, he's very well on his way to a Nord 7 in the next few years, maybe even sooner, if he doesn't continue going the pharmacological route. This next photo here is 3 months progress with treatment, just amazing results. And this is also when he decided to pull the trigger and stop on his hair loss medication after he had gained a good majority of his hair back. He most likely could have even further seen improvement had he continued with his treatment. And I say this because he was, such a early hyper responder, but he decided to stop due to personal reasons that he hasn't really talked about in detail. And let me remind you guys that he was using, minoxidil this whole time in addition to RU-5841, microneedling. So I feel like his post title, what happens if you stop using minoxidil and then start again, is a little bit misleading, since it sounds like he's kind of like just giving all of the credit to his hair growth to minoxidil instead of the other treatments, microneedling and RU-5841, which could have also triggered regrowth. But then again, there's really no way for him to tell, since he was stacking on all these treatments simultaneously. He also stated that he felt like he didn't really see any results from RU. But, he also didn't contribute to the fact that an anti-androgen like RU-5841 is supposed to slow down further hair loss, and he doesn't really take into account of that. So, but like I said, who knows? Anyway, we can see some pretty noticeable density all throughout the scalp, particularly the frontal region. His hair is a little bit grown out, but it's clear to see that it's night and day in terms of improved density compared to what his baseline photo looked like 7 months ago. He obviously has a much more defined and filled in hairline. The temples have also really beefed up in density, as well as mid-scalp. We don't really have a good angle shot of the crown, but it's definitely showing improvement, and we can see that it's also filled in quite nicely. And it's just really incredible that in just a short span of just 3 months, he was able to just respond so favorably. And this typically isn't the result, that most people would like to see, at least not in a span of just 3 months. And this is a case, though, for those who usually happen to be really good responders to minoxidil and other hair loss treatments. He does have sufficient levels of sulfotransferase enzyme in the outer root sheath of hair follicles. You will be able to metabolize minoxidil into its active metabolite minoxidil sulfate a lot better. Now, if you don't have sufficient levels of this enzyme, you're probably going to be better off going the oral minoxidil route, which can come with more side effects, so it kind of depends on your risk tolerance. I'm sure microneedling and RU584-1 really helped as well, since we have studies that confirm that using minoxidil in conjunction with microneedling is shown to have increased hair count and density, as well as with better absorption. And with RU, he's basically blocking the androgen receptors in the hair follicles from binding to androgens, which would theoretically stabilize hair loss. So there's a good chance that there was this, synergistic effect that led to his hair regrowth. But in the short period of time, it's most likely that minoxidil was the main driving force leading to hair growth stimulation. I will also note that he also noticed a heavy shedding phase shortly after using minoxidil. And according to him, it lasted around 2 weeks before he started seeing improvement. And this initial shedding phase typically happens around 2 to 6 weeks into treatment for those people who are taking minoxidil. And it's seen as a good sign because it shows that the dormant hairs are shedding so that they can make room for new growth and ultimately, better growth down the line in a few months after the life cycle of hairs affected by minoxidil have run its course. Minoxidil in turn is going to help widen up these hair follicles. It's going to increase the diameter, and it's also going to help allow these hairs to stay longer in the anagen phase for a longer period of time. And this is exactly what had happened as this guy continued on his treatment for 3 short months. Now, as previously mentioned, for some personal reason, he decided to stop cold turkey on all of his hair loss treatments for the next 3 months. And this next photo here shows him in a different angle, showcasing his hair. And to be honest, it still looks pretty decent, at least better than what his baseline photo used to look like. And even at 3 months after cessation of his hair loss treatments, minoxidil, microneedling, and RU584-1, it looks like his hair is in decent shape. But like I said, it's just going to be a matter of time before he goes back to what his hair used to look like before he incorporated different hair loss treatments. Because at this point, he's not doing anything to block or lower endogenous androgens, causing havoc to his hair follicles. And without using minoxidil, there is no mechanism of action to stimulate better blood flow and nutrients into these hair follicles to help prolong the anagen phase. And then finally, this is what he currently looks like. He states that he hopped back on minoxidil about 2 weeks ago. Man, we can see a lot of the hairs that have shed due to stopping his hair loss treatment for the past 3 months. It's likely that he induced acute telogen effluvium by stopping minoxidil. This is the truth. When you stop hair loss medication, the hairs are going to go with it. All of the gains that you guys were able to achieve, no matter how much you were able to reverse your hair loss, you are going to go back to how you used to look like prior to treatment. And from this photo, we can see some really bad miniaturization starting to take place, especially on the mid-scalp and also the crown area. And his hairline, once again, is losing density. The temples are showing signs of thinning again. And it's just looking bad, So this is what happens, guys. This guy was basically on a yo-yo effect of stopping and starting hair loss treatments over and over again in short bursts. Guys who are never really consistent with treatment, you will never be able to recover or improve the quality of your hair. And it's a shame that he looked so good while he was on treatment. But then, the reality of this is that you guys can't stop with hair loss treatments unless you're just basically throwing in the towel and just calling it quits. Drugs like minoxidil, finasteride, dutasteride, RU584-1, microneedling, every current hair loss treatment available, as well as the ones that are currently undergoing clinical trials, are going to require long-term commitment in order for it to work well. And you also have to trust the process in doing so. You can't just take it for the next 6 months or for a year and then stop treatment just because you guys have started seeing good growth or you're at a point where you feel like you have enough hair. And speaking of minoxidil, I want to remind you that minoxidil is not going to prevent hair loss. I talked about this numerous times on my channel, especially with Justin, the guy who won the free hair transplant at Cosmetica. The issue that I bring up with him is that he's only taking minoxidil and no other anti-androgen or 5-AR inhibitors, especially after having undergone a really quality hair transplant. And all minoxidil does is it acts as a vasodilator, It's going to increase oxygen and blood flow to the scalp to encourage growth, but it's not going to do anything to prevent the endogenous androgens in the body that is ultimately causing havoc to these hair follicles to miniaturize. You might be able to visually offset hair loss just because you're growing hair at a faster and better rate, but over time, you will eventually lose ground and continue to lose more and more hair as the healthy hairs that are going to get miniaturized via androgens they are going to be offset by the amount that you have grown with minoxidil. So this means that you're also not going to be able to maintain minoxidil grown hair after you stop using minoxidil with finasteride or some other anti-androgen or any other hair loss treatments. The reality is that hairs that were grown via minoxidil are going to be 100% dependent on minoxidil. So at the end of the day, the thing that you guys can really take from this and from this guy's example is that treatments have to be used long term. It's a huge lifetime commitment that you have to make in order to maintain the hairs that you have, as well as to slow down further progression of hair loss. And not everyone is going to be up for this. You're going to have people who were able to achieve a full head of hair, only to lose all of it just because they decided to stop treatment for whatever reason. It could have been for personal reasons, it could have been due to side effects. And I think this guy's example serves as a good example and a reminder that we need to really push through and continue this lifelong process of upkeeping our hairs with medication, because unfortunately, we currently don't have a cure for hair loss, and it's likely that we probably will not have one anytime soon. The good news for this guy though is that, and also for most people, is that for those who are good responders, if you initially saw some pretty good growth from treatment, you'll very likely respond favorably the second time around. So don't do what this guy did, learn from his mistakes, and if you guys are really serious about your hair, make that full commitment. Don't half-ass your treatments, give it your 110%, and I'll bet you that you'll thank yourself in the long run. Anyway guys, keep up the good fight against hair loss. Let me know if you guys have any questions in the comment section below. I also hold one-on-one private consultations for those who want to discuss about your current hair loss situation. Maybe you want to get good advice in finding a good hair transplant doctor, or maybe just want to talk about just hair loss in general or treatments. You guys can check out my description box below, and I'll have a link there where you guys can sign up for the consult. Anyway guys, thanks for all of your support, thanks for everything, and I will talk to you guys in my next video. Take care.